Welcome. In this tutorial, we're going to walk through an eChart GI chart or screening colonoscopy. A few things to make note of. In eChart, the schedule comes directly from the practice management schedule. However, you'll notice some different functionality. The paperclip will indicate that there are documents attached. The dog ear will indicate that there are appointment notes attached. If there is a red dot in the dog ear, that would indicate clinical notes. The color of the patient's appointment will change automatically as the patient moves through the continuum of care. The bold vertical line indicates the anesthesia type. This allows your users to simply look at the schedule and know where the patients are and what type of anesthesia they'll be having. Also, in the schedule, you'll be able to tap to enter a chart, as we have here. eChart is a browser-based application. That means anywhere that you can access a Chrome browser, you can access HST eChart. eChart is designed tablet first and touch screen. That means it will resize itself automatically based on the tablet and the portrait or landscape display of that tablet. The user is able to move through the chart by scrolling and tapping. The first page that you enter when you tap into the chart is the current visit summary. The user does not need to interact with the current visit summary. It will update automatically as the patient is cared for in each area of care. In eChart, the areas of care are divided into workflows. Each of those workflows is designed to allow the user to stay within their workflow to get all the charting done that's required for this patient for this case. Charts may be differently configured for each service type. The other tabs, clinical notes, is where you would add a clinical note to this case. If you send out specimens, this is where you will reconcile those specimens. If you have OMP as your outside patient portal, the patient portal data will fill in here. If you are utilizing ePrescribe directly from eChart, that is located in this last tab. If your patient has a previous visit in eChart, you will also have a previous visit summary tab where you can access the PDF of the previous visit. In the header of eChart, you'll notice that there is the ability to capture a picture of the patient so that you can see the patient's image when you're charting on them. Why is that important? Because in HST eChart, the user is allowed to keep multiple charts open at the same time, and multiple people are allowed to be in the chart at the same time. That's very important in the ASC space because that is actually how we take care of our patients. So your pre-op nurse might be taking care of 3 patients at the same time. She might need to toggle back and forth between care. We have set it up so that you can use, in the far right, a push pin. The push pin allows you to pin this workflow to the toolbar so that when you navigate away, you can quite easily toggle back into this chart as you need to. Next to the push pin, you'll see a yellow rectangle. That is the completion indicator. In HST eChart, the indicator will tell you the status of every single workflow. It will also, in the workflow, tell you the status of that workflow. The print icon is there because you can print any workflow, any page, or various parts of any workflow, and you can also create a print set that will pull in different sections of the chart for you to print at what time. Why would that be useful? If you're going to transfer a patient and you have certain sections of the chart that you'd like to print and send with the ambulance driver for that transfer to the acute care facility, you can create a print set for patient transfer. And you can create one for anesthesia billing, you could create one for operative reports, and you can also create one for the discharge of the patient home. The I button is for information. It will always display for you the patient's allergies and any detailed information about that, including, in this case, the consent banner alert. Why would you get a consent banner alert? Until your consents have been signed, this alert will remain at the top of the chart to notify all users that this patient does not have signed consents. Let's go ahead and look at a workflow. In pre-op communications, this workflow is where your users will document the call that they've made to the patient prior to the procedure. Each section of information is divided into blocks of data. In eChart, these blocks of data can be used or not used, and importantly, arranged in an order that best suits your ability to scroll and chart. Each one of these blocks has several capabilities. The first one, in the ellipsis in the far right corner, you can add a new block should you need one. You can remove a non-mandatory block if it is unnecessary. You can view the audit log, which will tell you who made entries and when and what change was made. If this person went in and changed the call to a different value, it will also note that as well. This is important when you have multiple people in the same chart at the same time. You're able to see changes that were made for any user. The second block, patient information, comes from the practice management software. It fills in automatically the information that is known about this patient from the scheduling. You can also fill in the gender identity, the patient's preferred name, any information that is changed here, including the addition of a middle initial. Once it is saved, we'll put that middle initial immediately in the header. Any changes here are also made immediately in practice management. You'll notice when I entered that D and moved to the next field, it saved the information directly to the database. I did not have to push a save button. That's really important if you're in the middle of taking care of a patient and you're called away and have to come back. If HIPAA timed out your device, you will not have lost the data you've already entered. So we don't ask you to save, we automatically save. And we save this information directly to the database. So it is not saved on the device you're using. That is important because for HIPAA purposes, no one can access the data that's stored in the database unless they have a username and password, regardless of what's been charted on that laptop, desktop, or tablet. Each block itself contains a completion indicator. The completion indicator, as it changes color, is connected to the completion indicator at the top. This call was made yesterday. The allergies were reviewed. The home medications were also reviewed. HST eChart has a unique feature that allows you to import 12 months of patients' prescription history with their permission from our third-party application, DoseSpot. That is also where you would e-prescribe directly from the patient's chart if you have qualified your physicians to do that process. But you can always bring in that patient's medication history with their permission. If they do not give you permission, you can still add prescriptions that the patient takes at home by typing in a few quick letters. Maybe the patient takes one tablet. Maybe they don't know what the dose of that tablet is. What's interesting in HST chart is behind the scenes, anytime that you add an allergy or a home med or a medication order within the chart, the system does a drug allergy check for all potential medications against all allergies, home medications, and other medications that have already been ordered. This happens automatically, and it happens not just once. So if you add another allergy, it will redo the check. If you add another home med, it will redo the check. If you add a new medication order, it will redo the check throughout the entire chart. There are certain kinds of blocks in HST that are called questionnaires. These blocks are designed at the center level. You get to decide what questions you would like to ask the patient for their medical surgical history. If the patient said yes, you can even have nested questions. When they have nested questions, you can even have a nested question below that. So you can have a parent, a child, and another child. Colonoscopy pre-op instructions is an example of a questionnaire that you will put in a colonoscopy screening procedure. HST chart type, along with all of the questionnaires that you have designed, the order set, the discharge instructions, and the operative report template are all connected to the physician provider and the procedure type in the preference card. Accurate preference cards give you accurate charting and documentation opportunities. It also helps you keep your preference cards up to snuff because completing those preference cards will fill in certain blocks in HST chart. It helps with case costing, and it helps with ordering and inventory management. As you can see, the questions that you can ask are completely up to you. Some hard-coded blocks have discrete data in different fields that we can run reports off of. Again, patient's instructions. So you see here, my completion indicator for this block is red. Anytime you have a red indicator, you can tap on it, and it will tell you exactly what field is missing that is required. So you're able to check that box. Your warning goes away, you get your green check mark, and you get your 100% completion. Each of these workflows can be designed for a specific type of chart or a GI chart. Your colonoscopy chart can be different than your endoscopy chart if that is how you choose to do it. Registration start is a simple tap of a button, although you can always edit the times in eChart by clicking up or down the hours and minutes. In order to enter the staff, it's simply tapping on the Me button. This identifies the person who is logged in and puts their information directly into the field. If it is not the logged in user, you can always search with just a few letters and enter the name of the staff who is doing that process. You'll see again here the patient information. The D that we changed in the pre-op phone call is now also changed. Wherever the block exists, the data in the block will flow with it. That is one of the tenets of HST chart. We want to make sure that data does not have to be repeatedly entered for exactly the same procedure, for exactly the same questions that you're asking. That only asks for problems, right? You might potentially enter the information wrong the second or the third time. So everybody in eChart is working off the same database. knowledge. Because this information came from another workflow, we have a new indicator here, purple triangle. It's just saying this information all came from somewhere else. Do you accept it? Consents in eChart utilize the tablet feature by allowing the patient to sign directly on the touch screen. Now, these sample consents are just that, samples. When you have HST eChart, the consent is your consent. We help you upload it. We give you the tools and the ability and the training to edit, to change, and to build your own consents. The witness, again, can tap by simply signing on the button, or in this case, since we know I am not the registration, they can simply tap over my shoulder. So Mimi can enter her username and password, if she can type right, and you can see that it will sign directly over my shoulder without anyone having to navigate away from their workflow and their chart. Again, registration end is the simple tap of a button. The next block is the staff block. As you can see, the data entered the staff block automatically. I did not have to interact with this block. You can, if there are more than that person, you can use the plus button, get the flyout, and enter the information of another staff, should you need to do that. In registration, once the patient is at your facility, this is when you can utilize the camera and be able to take a picture of the patient. In this case, I'm going to use a picture I have on file. Doesn't look like a John. In this case, we'll use this picture to identify the patient. But I wanted to show you very quickly how we pinned this chart to the bottom when we were in the pre-op call, the homepage workflow. I can pin this workflow as well, and now I'll be able to toggle back to this homepage and back to the page I was just in, along, and it will take me directly to the last completed block. In this case, they're all completed, so I'm at 100%. To unpin a chart, simply need to unclick it. You can also unpin the chart in the toolbar by clicking on the X. Many users have found it helpful, especially pre-op users, to pin their patients along the bottom as they're taking care of them. And as they move on in the continuum of care, they can just X through them. If you leave charts pinned to your login at the end of the day, the system will unpin any charts. However, if you change devices and log in from somewhere else, your pinned items will remain in the pin bar until the next day. So let's go ahead into pre-op. Well, you can enter the NPO status. Hopefully this patient hasn't had anything to eat or drink for a while. And the green check. The allergies were entered in that pre-op call, but I'm required to review them in each workflow. You can enter the height and weight of your patient in imperial or US numeric, or you can enter them in metric. Either way, the other value will display on the right. The system takes the patient's weight in kilograms and puts it in the header on the patient information line. This is important if you need to give emergency medications in a hurry, We want that information to be at your fingertips and not have to go through the chart to find out where the height and weight is kept. We also automatically calculate the patient's BMI, put it in the anesthesia row in the header. It's also calculated in the block. This block allows you to document what you have done with the patient's valuables. For example, maybe you left on their wedding ring. Maybe you let them keep their glasses. And maybe you gave the purse and cell phone to husband. You can write the name of that responsible party, and you can either have the patient sign, you can have the responsible party sign, or you as the logged in user can tap and sign as well. Then we have the room in block. And I want you to notice we have already completed several blocks before we've gotten to the room in. That's because at this surgery center, when the nurse goes out into the lobby to meet the patient, who they can easily recognize because the picture is in the upper left corner, on their way back to pre-op, they will have asked the questions that we've just seen. They will have asked the patient, had they had anything to eat or drink? They would have checked their allergies. Maybe they passed the scales, got their height, weight, BMI. They locked up their valuables or gave the valuables to the family member. And then they got into the room and put in the room in time. They will put in here also the room that they're in, the staff taking care of the patient, and of course, how they got to you. This information in the room in block that is in each workflow also populates the patient locator that's on the schedule screen. The patient locator will tell you where the patient is at all times during the continuum of care, and will also tell you the patient's status. We'll discuss status in just a second. This block was designed for prep information for the colonoscopy. You may have other questions that you want to ask. You can design this yourself, but this is where you can pick the prep that's used. You can see if they took all of their prep and what was the stool consistency when they finished their prep. Physician orders in eChart are loaded based on the preference card as we discussed. But before anyone signs the orders, the physician is able to change the orders to another set if it pertained to this patient better than the set that was selected. To sign the orders, you simply select them all, or the ones you would like to select, and sign for them. The physician will sign all of the orders in the physician workflow. Let's take a look at the physician workflow before we go any further. I'm going to push a pin in this workflow so I know that we can come back to it. I'm going to go over to the physician workflow. Each workflow is different and will only contain the blocks that the user needs to document the care of this patient. The physician will want to look at the patient's history and physical that came from the primary care. They can tap on that. It will open the patient's history and physical in a new tab for you to look at and review. The physician can toggle back and forth without losing his place and can mark that he's indeed seen that. Anywhere in eChart where you have the ability to order medications or administer medications, the patient's allergies will appear in a red rectangle above the place where you would order or administer. You can see here the items signed by the pre-op nurse can no longer be altered, particularly if they are standing orders. But let's say the physician wanted to change this order. You are still able to strike it through. So for example, you can write that this is an error because maybe the nurse said, do you really want to have a saline lock, or would you prefer to have a bag of saline hung? This is where you would add in the area, the order, for me, it would be a verbal order, and I received it from the physician at this time. You will see that it populates here. The physician is able to sign all of his orders in one place. The system will parse out those orders to each area of care. Again, I'm going to use the over-the-shoulder feature. And you are able to clearly see that these orders are now signed. In the far right, you can see the med check gave me a caution because these medications will affect the central nervous system. To read the caution, it will tell you that may cause profound sedation, respiratory depression, and we need to be aware of that, but of course, that is the result that we're hoping for, that the patient will be sedated. You can also have hidden orders. These are orders that are in the background, queued up, if you will, ready for the physician to use. He can tap that button, and you can see here, blood sugar for diabetic patients. If this patient is not diabetic, and he doesn't want to sign that, he is able to hide the unsigned orders, and they will disappear. The struck through order will remain there because we want to make sure that everybody is aware that this order has changed. History and physical attestation must be signed by the provider on the day of surgery. Because there is an H&P within 30 days already in Document Central, we have pre-populated that information. However, if your surgeons do their own H&P on the day of surgery, you can use an H&P block directly in their workflow. But this is selected automatically for them, as is that they have examined the patient and that the patient is approved for the surgery. This is where they will sign that attestation. If they have to do an H&P on their own on the day of surgery, this is where they would fill in that H&P. The information that we have known about this by other people's documentation will automatically populate. They can maybe choose that the patient has maybe 2 drinks per week. Review of systems, anesthesia concerns or issues. The height and the weight and the BMI populated automatically. They would just check their physical exam of that patient on the day of surgery and any specific exam for this surgery. You might want to discuss the prep here. In this case, we add the addendum and the approval directly to the H&P. So if the physician completes this and signs it, it will automatically complete the H&P attestation. We scroll up a bit, you'll be able to see that we automatically completed that attestation because it was signed in the process of doing that H&P. We have the consent designed by you at your surgery center. These are your words, not ours. The patient, again, would sign by scribbling. As the nurse, I will just tap and sign. And my provider will sign over my shoulder. Medication reconciliation block, should you require your providers to do this, will pull the information directly from the home medication tab. Most of the time, the provider doing this colonoscopy is not the provider who ordered that Lipitor. So he's not going to want to say anything but resume as prescribed. If it is a medication they do not want to be resumed, they can enter that as well. Do not resume or resume in X many days or hours. You'll notice there was also a drug allergy check done on that home medication. And we get a green check, which means no issues. If there was a true allergy or a true drug reaction, you will see a red exclamation point. Any prescriptions given to the patient upon discharge from the center need to be entered here. However, if you do not, or if the prescriptions were entered or given to the patient by the clinic or office, you would check this button here. The physician again would sign. The immediate postoperative note is only required if they do not have an operative note on the chart when the patient is brought to PACU or post-op. So it is not always necessary to have this block in the workflow. You'll notice it will not allow me to sign regardless of the user because we haven't done the procedure yet. And that is the safety feature, to make sure that nothing is signed before it needs to be signed. But you'll notice that the information at the top is already pre-populating. All of this information at the top will pre-populate for the provider, including anesthesia, including implants, and including specimens. Let's go ahead and jump back to that pre-op workflow. And it brought me right down to the last block I completed. And as you can see now, the physician has signed that. I did not sign the normal saline order yet, so I'm going to go ahead and sign that now. Anesthesia orders work much the same way. If this patient is having conscious sedation, the orders will be associated with conscious sedation. If it is a general or regional or local, you will have different order sets for different anesthesia types. Occasionally, you'll have a medication order that's a prophylactic antibiotic. And this is clearly telling you that you have to have a prophylactic antibiotic administration block in the chart as well. We're going to just delete this order because this physician does not require a prophylactic antibiotic. And then I am able to select. We also changed the HEPLOC to saline flush to hanging saline bag. So I'm just going to sign the one order. And then I'm going to delete the order that we did not sign. It's important to note, if at your surgery center, the anesthesia department is in charge of ordering the IVs and the in-house lab tests like urine analysis for pregnancy and blood sugar tests, you do not have to duplicate those orders in the physician order set. You only have one provider who needs to request those tests be done. Here's the home medication with the Lipitor that we saw. Maybe we want to ask this patient, when did you last take this? And they say to us it was yesterday. We can apply that last dose date here. Consent for procedure that we had signed in the physician workflow will show up in this area as already signed in another workflow. I simply have to accept it. Vital signs in HST chart can be pulled directly from an interface with your patient monitor. If you do not have an interface with the monitor, and very often pre-op does not, you can pull in vital signs manually. I'm just going to enter a quick set of vital signs. The information in vital signs in pre-op, particularly the blood pressure, is used in the modified Aldrete block in the post-op area because you have to compare the circulatory condition of the patient preoperatively with the circulatory condition of the patient in post-op. The system will do that for you as long as it has data to compare with. Let's say you come back to see this patient 15 minutes later. The vital signs are almost exactly the same, but not quite. We have a feature called clone. It allows you to clone this row with a now time. And maybe they're just a little bit more relaxed now. Their heart rate has come down, their blood pressure has come down, and their respiratory rate has come down. So you don't have to enter the entire row again. You just have to correct any minor changes that happened to the patient's vital signs in pre-op. The pain assessment score is cumulative. So what that means is when you assess the patient's pain in pre-op, when you get to post-op, it will tell you, it will be the exact same block, and it will have the pre-op values and intra-op values if that's important, along with post-op values. Patient limitations would be entered here, their psychosocial status, their fall risk assessment. This is called a clinical decision support block. This is where you would mention fill out the assessment of the patient, and the system will give them a score and a risk level. And if the score is high enough, it will put that banner alert up here in the header. You should also note that the consent alert is now gone from the header because we have assigned consent. We're going to just give a few things. Interventions. IV insertion will happen here. We also give you the opportunity to record any attempts at the IV that did not result in a successful insertion. We have a report and practice management that you can run that will help you guide you in giving those clinicians that maybe need a little more education on IV insertion or a little one-on-one intervention for them to do a better job. And this can be one of your QAPI studies. Medication administration. Any medications ordered would be administered in this block. The medications don't show up here unless they are standing medications or until they have been signed by the provider. Once they've been signed, the medications will appear here. Both anesthesia and physician medications will appear in the medication administration block. Your pre-op surgical safety checklist is designed by you. Again, this is one of those questionnaire blocks. The patient status. This status is reflected on the patient locator, as we discussed. If the patient is ready for the OR, you can simply tap ready. There are other statuses that you can design or for your center that are pertinent. Maybe they're ready for anesthesia to come talk. Maybe they're delayed because of their NPO status or whatever reason. You get to create these at your center. I'm just going to say that they're ready for anesthesia. Supplies used. Your center may not currently track supplies used in pre-op. That is not unusual. However, if you want truly accurate case costing and you want to provide this to the nurses in pre-op, it will automatically populate from the preference card items directly into supplies used. It will not send a 0 supplies used, and you can edit that pretty quickly by changing it to 1. And you can send them and confirm. This will send the supplies directly to inventory management in the practice management part of HST pathways. If you decided, oh, you know what, I use 2 of those, you can clone that entry and save it, and it will enter a new instance. To send that new instance, you only have to send supplies confirmed again. It will not resend supplies that have already been sent. Because the pre-op nurse does not always know who's taking their patient to the OR and doesn't maybe know exactly what time they left because they're in the process of getting 2 or 3 other patients ready simultaneously, this block and the staff out time will fill in automatically from the next workflows room in. In this case, the intra-op room in time will automatically fill in the room out time and the staff. Let's pop over to anesthesia since we said that the patient was ready for anesthesia. Your anesthesia provider can build this workflow to suit the needs of your anesthesia team. In this case, again, H&P is available for review. We have an anesthesia history block you do not have to use. The eChart hard-coded block, you could create your own, but it pretty much covers previous anesthesia, family history, their medical history. We already know that they have lipidemia, so we'll keep our eyes open for that one. Pulmonary, no disease. Endocrinology, there it is, because we know they're on Lipitor. No disease and no disease. Now, performed by, the history for anesthesia can be performed on your pre-op phone call, or it can be performed by another nurse provider, or it can be performed by your anesthesia provider. In this case, we're going to pick Dr. Brock. The NPO information filled in automatically from the pre-op workflow. Any in-house lab tests that were ordered, the results will appear here for the physician to review. The height, weight, BMI, and the anesthesia preoperative physical assessment. This assessment meets the CMS requirements for examining the patient prior to the start of procedure. And I'm just going to fill it out here. The planned anesthesia and secondary anesthesia type, if there is one, is in this anesthesia history and physical. Does not mean that they can't change their mind when they actually get into the OR. We're going to say that this was also performed by doctors. You can, if you want, include an anesthesia consent, and that consent can have as much or as little information as you want it to have. It can be an alert type, in which case it will still leave the consent banner alert in the header, or it can just be a simple anesthesia consent. Some surgery centers even have the anesthesia consent built within the procedure consent. We do not intend to change your workflow. eChart will work with whatever your policies and procedures are for consents. Here are the anesthesia orders. And again, the anesthesia provider would sign by tapping on this. This gives me a great opportunity to create for you, to show you what it looks like if you have two users working in the same chart at the same time. So I'm going to log in as Dr. Brock and share the screen to show you what it would look like when somebody makes a change that will affect your workflow along with Dr. Brock's workflow. I'm going to resize this, and I'm going to bring over the logged in user of Dr. Brock. In this case, you're easily able to see that I am logged in here as two different users. Dr. Brock is an anesthesia provider, and he will pull directly into that sedation workflow. I am here as myself. When Dr. Brock signs off on his orders, I am notified immediately that those orders have been signed off on. So what you see is a purple halo and a different icon in the corner, and that the block was edited by Dr. Brock. And you can see now that he has signed all of those orders. So anywhere that these orders live, including the medication admin, will now show that there has been a change, and that retweet icon will show in the completion indicator as well. Once you accept it, it will go away. So that is super important. It's called live edit. And what it means is any changes to any block that will affect multiple users in different workflows or the same workflow will be notified by a purple halo and a live edit and who made that change. So we are all working off the same information to care for this patient. If an allergy is added, we are all informed of that allergy. If an order is added, we are all informed of that allergy. The care team for this patient are kept aware of changes that another clinician might make that will affect their care. Okay, so as long as I am logged in over here as the anesthesia provider, let's proceed as that provider. Anesthesia start time, anesthesia provider. If in your state you use CRNAs, and CRNAs are independent practitioners, this area of supervisor provider will not appear. If for your colonoscopy you use nurse monitors, then the provider would be the performing physician who is supervising you. So this can show or not show. It's a configuration setting, and you get to decide that at the beginning. In this case, this is the anesthesiologist, so he does not need supervision. Anesthesia care, typical monitors that you would attach to the patient. And the position comes from the circulator nurse who puts the position in, and if there's anything that you're doing to the eyes. The anesthesia graph is the crowning glory of the anesthesia workflow. As you can see, You can pull in the vital signs directly from the monitor. This is where you can change what type of anesthesia you're giving. If that patient couldn't handle sedation and maybe you had to put them to sleep, this is where you would change the anesthesia type. That change will also affect the header, and everybody down the row, including practice management, will be aware of the anesthesia type change. You would pull in your patient monitor, your gas monitor data if you have that interface. You can manage the medications that appear on the side here. Maybe you're using propofol. Maybe you're out of propofol, so you're not using propofol, and instead you're using fentanyl and midazolam. If you need to change them on the fly, you can. If you change it to general anesthesia, you can also do that on the fly and add more medications for the general. You can manage your gases much the same way. You're going to be giving oxygen and perhaps SIBO or any of the other ones. You can pre-populate the gases and the medications that show up here based on the chart type in advance. So you do not have to add them each and every time. They can just be here ready for you to use. The temperature, level of consciousness, and title, EBL, IV fluids, urine analysis. What's important to know about the EBL is it will also appear on the operative report, if indeed you have any EBL at all. IV fluids that are given during the course of this patient's care in anesthesia, when entered here, will populate, I'm just going to put 300, it will populate the intake and output block for the post-op people. So the recovery room team never has to chase you down to ask how much fluid you gave in the OR, and if any, how much urine output there was. This will automatically populate the intake and output block in their workflow. We have respirator settings as well. And then you have the graph itself. So the table above has information, gases, medications. The graph below is where your vital signs will show. If you do not have an interface pulling in your vital signs, you are able to drag and drop your vital signs, and as you could see, it could be an exact number and time. You can also add the heart rate, and you can add the respiratory effort. That vital signs will graph itself as the time moves. The green line is always the now line. If you wanted to add a note, it is as simple as dropping in a note and saving it. Anyone who hovers over there will be able to see that note. When the chart prints, that note will print on the graph as well. As you add more vital signs, it will graph them for you. Draw that line in between, and your carets for your blood pressure will remain. Below the graph, we actually have a grid representation of each of those values. So you'll be able to see gases, medications, infusions, vital signs, which I just entered, intake and output, ventilator settings, and anesthesia events and notes, which is that note that I just put in here. You can have as many anesthesia providers as are in this case, and or supervising providers sign this graph. That's important for billing purposes. You can also create a print set, which is a series of blocks that you can put into a set that you can then send directly to your anesthesia billers so that they'll have what they need to bill your cases for you. Procedure start time. If it's filled out by the circulator, it will populate for you. The same is true for procedure out time. And then you have the anesthesia stop. You have your handoff. You can have PACU vital signs as a read-only in your workflow. Again, you don't have to navigate anywhere to have the information that you need to take care of this patient. Your post-anesthesia assessment is here as well. And again, the staff populates by itself. You can add supplies used if you'd like to track your anesthesia supplies, but you don't necessarily have to. So let's peek into the intra-op workflow. Again, we have allergies and we have room in. I'm going to back this up a few minutes. And in the background, you can have built-in late start study. You can turn this feature on and off, but it will track why this patient was NPO. I'm going to say they came to me by a stretcher, and indeed I am the receiving staff. eChart has a unique feature called Quick Chart. Once the patient is roomed in the intra-op workflow, you can rapidly apply information that stays the same case to case to case. What does that look like? As soon as you have a room in time, you can apply a quick chart. In this case, I only have pain. But when you apply that quick chart, it will rapidly complete all of the information that you need here. So I'm going to switch to my pre-op nurse because I was still the anesthesia provider. And the pre-op nurse is going to be able to apply that screening colonoscopy quick chart. Once I apply it, the system is working. It is going to rapidly complete those blocks that stay the same patient to patient to patient. And it's going to attach my name and date and time as making that entry. So as you can see here, positioning completed itself. The fire risk assessment is the same for all colonoscopy patients. The wound classification, again, it is the same. The equipment with the serial number is pre-populated because that is the room I am in and that is the piece of equipment there. Timeout will not be populated by quick chart. Timeout has to be completed because it is patient-specific and cannot be filled out the same for all patients. And procedure timeout must not be later than procedure start. So I better back that up. There we go. Solutions. Solutions were populated by the preference card, and it told me how many sterile waters I needed. Just for fun, I'm going to go ahead and change this to 6. Keep that number in mind. Here's physician orders, medication administration. We talked a little bit about medication administration, but not how to give the medicines. You can check and give them all together. You can check one and give it. This will always put in the now time. You can open it up and select your time and who administered it and save it. And it's going to fill that in. We also have a feature called confirmed. This is for those high risk. You can use it for your sound-alike lookalikes. You can use it for your pediatric patients. But you are able to have another user confirm the dose and what you've drawn up and what you're prepared to give. It is much the same way as any of our older over-the-shoulder users, where they would sign off in here and that they confirmed that you were correct in what you were going to give. Colonoscopy times, this is a hard-coded block where you would put what time the cecum was entered, or if it was not reached, when the withdrawal started. We're going to give them a minute to look around the cecum. and then when withdrawal was completed. And it's going to tell you how many minutes it took to withdraw. You can also use the features of the tablet, which is basically the tablet's camera, to take a picture of what is on the screen. If you do that, these images will appear here in this block so that you can see the cecum or any other images that you need to show. You can also mark your bowel prep here. If you use the score, you can use the score. If you use adequate, inadequate, you can use those measurements as well. And in case I'm going to say that it's adequate. You can also enter any notes that are specific to this block. The procedure information comes from practice management. You can load it. You can edit it. You can add a secondary. If you wanted to change the schedule procedure, you would have to do that in pre-op before the consents are signed. Diagnosis, that also comes from practice management, and you can load it in as well. You can add to it. You might want to add polyps. You might want to add whatever you found, but that is up to the physician and the provider. Specimens. If you take specimens, this is where you would enter that. If you, let's just say we're going to remove a polyp. And it was from the transverse colon on the left side. I sent it to a lab. The lab was St. Joe's for pathology. And of course, you could add as many as you needed to. If you do the CLO test, you can also use that as well. That would be more, not so much for colonoscopy. I just wanted to let you know it's an available block. And here are your supplies used. You'll notice that the sterile water that I changed to 6 changed here as well. So again, no double entry. If you enter something once, it should appear everywhere and it should be there. So we're going to confirm that. I'm going to leave room out and staff because I wanted to show you in the pre-op workflow. We go to room out and staff. You can see it filled itself out just like I promised it would. Okay, let's pop over to PACU. Room in, post-anesthesia airway. So let's go ahead and put in room in. Let's enter a post-anesthesia airway time. We're going to say they're still on maybe 4 liters by nasal cannula, and they're clear, unlabored. They could take a deep breath, and we don't need incentive spirometer, and I'm going to save that. Then we have our vital signs. Again, I'm going to use the room in time. I'm going to put what their post-op vital sign was and their heart rate, respirations, O2 stat, and we're still on 4. eChart does have built in a normothermia report that you can run for your CMS normothermia quality measure. Pain, you can see the pain assessment is still there from pre-op. I'm going to add in the post-op. Extremity check. If you decide to have this block in here, you can certainly say that and do that extremity check. We're not going to do it, it's a colonoscopy. But your modified Aldrete score is next. You can put in what time it is now. You can ask it to use the latest values. The latest values of what? The latest values of the blocks I just completed. So again, we're cutting down on duplicate effort. The system is going to say that they're able to take a deep breath and cough because we filled that in already. They're going to match the systolic blood pressure to the preoperative value because I already put in my vital signs. It's not going to answer consciousness, but it is going to say they're on supplemental O2, and it's going to check that box for me. So I just need to fill in the 2 that I have and move on. And it will do that each and every time. But remember, you don't have to do it that way. You can always just clone the row.
For that, you'll have to unlock your device first.
I'm going to enter the time. And I'm going to say that now they're fully awake and they're no longer on the oxygen. Physician orders, anesthesia orders, patient education, dressing assessment, intake and output. There's that anesthesia value that we talked about. Medication administration, discharge instructions. You get to create these instructions. You can put them together as a set, or you could just have one single instruction. You can edit those instructions directly in line. You can print these instructions for the patient to take home with them. Add any additional instructions that are specific to this patient. The nurse would review them, and the patient or their family member would sign that they have reviewed them as well. In this case, we're just going to have the patient review. And we have their discharge status, who discharged them, how they got to their car, who they left in care of. The staff will fill out automatically, supplies used will. We also have a block for quality metrics. These are the metrics that CMS requires you to fill out and submit. So we make it very easy for you. You're able to say, did the patient have any of the following? Important to know, the quality metric block is not printed with the printed PDF of the chart. It is simply for collection of data for your CMS requirements. So we're going to say no. It will say that there's no hospital transfer or admission as well, because we selected that in our discharge status. The discharge status is available is the list from CMS. So we get that 2 birds with 1 stone. You'll now be able to see that the physician can complete his workflow because the operative report and the interim operative report have filled in and are ready for signature. Now, an operative report can come into eChart in 3 different ways. You can dictate the operative report or have it come off of your Olympus or whatever system you're using, and you can attach it here as a document type. You can use a template where it will pre-populate that template for you when you open the chart. You can dictate directly in using drag and dictation or any other directly into this field. So 3 ways to get those operative reports in here. Because we took a polyp, this is going to sit here, and it's going to sit here until the results are linked. That's going to let the doctor know we don't have the results linked. As soon as the results are linked, a task will be created. Now, we haven't talked about tasks yet, so now is a good time to do that. In HST chart, every night, the system will plow through all of your charts and do a chart audit for you. It will pull out any charts that have any fields that are incomplete. It will assign that workflow to the most likely user, whoever filled in the most blocks in that workflow. They will be assigned a task. The task will sit there for them to fill out, and to complete a task next time they log in, you just have to tap into that workflow. It will take them directly to the block that they have to finish filling in. And you're able to complete that, go back, and that task will fall off your task list. It will also create a task for that lab results, but not until the results have been matched. So we have one more workflow to look at. I'm sure you can pretty much guess what that is. And it is the post-op communication. So very much like pre-op communication, you are able to call the patient post-op and document that in eChart. And it will have that same communication log where you can say date and time and the user. Was it completed, fully completed? Did you leave a message? Who you spoke with and what language you used? And it has that patient information block that we already know about. Then it has the post-op questions that you will ask your patient. And this is very specific to the procedures that you're doing. That ends the walkthrough for a GI chart, a colonoscopy screening chart in HST pathways. Thank you so much for joining us.